How are you? Just get you to unmute yourself.
Can you hear me? Hi.
Yes.
How are
Hi.
you?
Amazing. So grateful to be connecting with you.
Yeah, me too. Thank you so much for that amazing 3 days. That
Oh,
was
you're so
very
welcome.
knowledgeable and very helpful in many ways.
Amazing. What are some key takeaways that you got from it?
Um, well, so definitely being like I've tested on my client yesterday, just getting into my own zone, like, just getting intention for the treatment. And I think sometimes I'm just so busy that I do forget that. And I've actually noticed that that makes a huge difference for a client, what I'm actually treating. Even though I'm also a Reiki practitioner, so sometimes I do that, but sometimes if something happens during the day, it's really hard to ground yourself and just do it. So yeah, I think that, and also the things about the transgender, the changes in the yeah, is I think it's called transgender. Yeah. So yeah,
Transgender. Yep,
that's
that's
something
right.
what I haven't actually faced exactly yet, but I can see the potential, and especially that might actually happen in my family. So I'm not sure what's gonna be. So I will be able to support family member in that
Yeah,
as well.
amazing. Very cool. So it was a good introduction over a variety of different topics for you.
Yeah, definitely.
Amazing. I love it. So I'd love to know more about your practice now and
Mm.
what you do. You're in the UK, right?
Yes, I am in UK. I'm actually in the area where breast cancer, there is like hospital, oncology hospital. So last year I've been qualified as a scar therapist and an oncology scar specialist. And I've been doing quite lots of work with I'm doing also volunteering work, but also I've got my own practice. But I actually I've been trained, and I've got a cosmetology degree, a bachelor degree in cosmetology from Poland, because originally I'm from Poland. So I've been doing skin pretty much all my career. So that would be like 17 years now. And so I've been doing body treatments before in the beginning of my career. So I've been doing massages and things like that. But because I've been overdoing it, then I stopped completely and I decided to do skin. But when I did the scar therapy, I sort of started going again in the body because it was suggested to me that because I'm doing skin, maybe it would be better to focus on the face. But that wasn't for me only. Like I wanted to explore. And by accident happened, I started volunteering for the cancer patients, and I feel that this is really close to my heart. In a way, and I'm enjoying every single day. And if I don't go there or I don't treat people, I'm just literally missing so much. So it's really a rewarding job, and now I'm helping them a lot, but I feel like there's something missing in that. Um, Definitely I'm actually now um like sort of refreshing my anatomy properly, because obviously I know how the mass works, and but because I've trained in Poland, and when I came to UK, I've been only learning from UK from English, but I don't know the names properly in English. So I'm actually learning this now. So I know how everything works. It's just the sort of like terms, I would say. So I'm just now, yeah, learning that
Okay. So
again.
it sounds like you've got a sort of a variety of skill sets. You've got your cosmetology, you've got your skin, you've got your scar work, you're starting to get involved with oncology, and it feels like it's a fit for you,
Yeah.
right? So you've got,
Yeah.
yeah, you've got some good skill sets, and it sounds like you find it rewarding, but you feel like something's missing. Can you go a little bit more into what you feel like is missing? Is it just the terminology from Polish to English, or is there other things that you feel like
No,
that's missing?
it's not terminology. It's just more because what you were saying as well, that was really surprising for me that in America there are places what you're not allowed to do, for example, breast treatment. Like here it's completely legal, and it's just something what I actually never thought about. And I think what I'm actually missing the most, because actually recently I was saying to all my ladies that, okay, we're focusing on doing your scar and etc. But what about the other healthy breast? And I was like, you need to keep healthy breast. And if you want to have healthy breast, then it needs to happen that you need to massage it. And everyone like, I was always saying like, what do you think about if I would start doing breast treatment? Because that's what I was doing in Poland. But when I came to UK, they suddenly like was like, no, you can't touch it. But it's not like you cannot do it. You can. It's just people I found, especially women, they really like disconnecting, like they're thinking that the breast is only for like, I don't know, for men to touch, or but that's sexuality and nothing else. And obviously they're breastfeeding and etc. No one thinks about these things. So that's why I found very interesting when you start saying about the breast, sort of like the massaging and sort of everything, or work in general. So yeah, I would like to the main thing is for
Yeah,
me, I think, is just to be able to, because I don't know if it's sort of like sort of issue with that, but I'm finding working with people who has cancer and seeing people dying, it's really hard. And I'm a very emotional person, and sometimes it's just like, for me, it's because I really want to have hands-on, really straightforward. Like if I can see something, I can say straight away I want to put my hands on it. And I'm forgetting to step back and think about the other person, what might actually feel. And for me, being so direct and being Polish as well, that also it's like sometimes I feel like might not be the right way. Is it a bit different if I'm doing in my own space, in my own practice? But when I'm volunteering, everyone's so open, and it's like they just stripping, and they don't care. They allow me to take pictures. Sometimes I don't even have anything to cover them with. So they're absolutely fine. But when they're coming to my clinic, it's like more they just like feel it a bit more closed up. And even though I've been doing lots of work, not everyone is exactly the same. And I think that's my main sort of, yeah, to understand, to maybe also the way, yeah, to see how in a more gentle way I could say it
yeah,
to
yeah,
people. I don't know.
I hear you. So, I had a little bit of sticking in the internet connection, so I think I
Mm.
was able to pick up everything that you were saying, but I may have missed a couple things. Um, I'm wondering actually about turning our videos off so that
I don't know if it's my
we
internet
can
or
hear each other more effectively and make it better. Are you okay with that?
yeah, that's
Do you know how to
fine.
turn your video off? Okay, great.
Yeah.
And that way, sometimes the transmission, it's not as choppy when the video's not there.
Mm.
So, so what I'm hearing is that like in Poland, people are a lot more open to breast massage in general. And when you went to the UK, they were like, ah, I don't really know what reason I would do this. Breasts are for, sexuality, they're for mating, they're kind of used in that way, but I'm not used to taking care of them. And you've been helping to introduce people to this work, but it's required some education and bringing, awareness as to why healthy breast massage is really useful. And even though in your volunteering experience, people are more open. They're like, oh, sure, you can work on me. When they come to your clinic, they're more closed and it's a little bit more formal, maybe. Is that kind of right?
Yeah, yeah, I think it's just a little bit that barrier, because it's a different, because in where the charity is, I think because people are so appreciative that they can have treatment, because any kind of treatment, and they've got problem, and it just they by doing it, they feel much better. And I think that appreciation, and they know that if they do something, then it's gonna only help them. But if they come in privately, it's a little bit like they don't know me, they don't know surroundings, and it just feels sometimes off. And if I'm off a little bit, then also I can feel that it's a little bit different too.
Yeah. Yeah. Your presence and what you bring to the table is definitely influential. So, yeah, those times where you're not feeling completely on your A game, that can influence people's, just perceptions of the treatment and what they're getting. And yeah, but that's good awareness on your part to understand, it's kind of a joint co-creative process. So, what would you say if you were going to think about yourself a year from now? What would be your ideal scenario for your practice?
So, because I'm actually doing all scars and everything, I'm actually living in a small town, not that small, but small town. I moved from London, and I'm finding no one basically knows me here, so I'm trying um, for people to basically know about what I'm doing, and I'm actually struggling to show people what I'm doing. So if I will really want to, if I think what I want to do like in the year from now, I really want my practice um to move forward and have really good base clients and help as many people I can, and that people will be aware of what I'm actually doing, because I'm finding it a bit tricky, because here in the UK there is with the scar tissue lots of, like, there are physios what they're doing, also scar work and everything. So I'm not physio, I'm not a particular massage therapist as well, because I don't do massages anymore. I know how to do it, I've been trained with many types, but I don't really want to do it, and I'm not a beauty place, and also I'm not aesthetic place, so it's just sort of like positioning myself, um yeah, and sort of showing that I'm doing different, that is something different everyone else is doing.
Right.
And no one actually is doing proper, like, any oncology, um especially like after mastectomy, lumpectomy, no one is actually taking that on board. I think it's a little bit more complicated.
It is complex care for sure.
Yeah.
Okay, so it sounds like a year from now, you've relocated, you have to get to know your area again. You're in a new place, new people, they don't really know you, but you want to be able to move your practice forward. You want to be able to develop a good client base and people to understand what you're doing. But there's also some gaps that you're talking about. One of them is you're struggling a bit for people to know who you are so that You can fill your appointment book,
Yeah.
and a little bit like maybe you're having a bit of an identity crisis in terms of what you actually are as a
Yeah.
practitioner, because you've got so many different skill sets, and how do you fit them together?
Too
And
many.
yeah, what do you fit into? So the courses that I offer are around massage therapy. So is that something that you are interested in putting yourself forward as again to do massage therapy?
Well, the thing is, like, scar tissue, what I'm doing is the scar tissue massage. So I'm doing massage anyway. And as you doing, like as you said, like it's very gentle. So you don't actually putting pressure, you're not straining your body. That was
Yeah.
my key. And that's also what I took
Uh,
on the scar therapy for, because I was like, there's not way I'm gonna do massages again. So I need to find a way how I'm gonna help people, but not using my hands too much and not being tired after.
mhm,
Um, so that, but what actually struck me the most is that breast sort of massage thing and the care for breast, because because you mentioned as well about the scar tissue as well on your program.
yeah.
I would like to actually know how much is of, for example, massage and is something what I don't know, and how much is like the scar tissue. I know that I don't know everything yet, because there are lots of different things to do as well. But yeah, I would like to know how much of that is in your program.
I have a decent amount on scar tissue because the you can't get away from working with scars when you're working with this population. So we definitely go into scars. Whatever knowledge you've got already is going to be really useful for this population. In terms of the volume of scar work in an appointment with a patient, I mean, it varies quite a bit in terms of what the person's presentation is, but it's pretty much in every treatment that you'll be working with the scars. Maybe there's some people who come in and want attention to another area in relation to the surgery, but the scar itself is only the tip of the iceberg. And so, you know, you work with the scar, of course, you dedicate a certain portion of your treatment to the scar, the visible scar, the actual incision site, but above and below it, beside it, on either side, there's so many other parts that have been affected by the surgery that the scar work is a portion of the treatment, but it's not the whole thing. So you learn to work in other areas in other ways to address the body through lymphatic drainage, through the circulatory work, through joint mobilization, working with the tendon so you can affect the muscle without working deeply on the muscle belly itself. So
Mm-hmm.
there's a variety of different ways that you approach the actual treatment. But in the course, we go over different scar patterns so that you understand what the typical scar patterns are, what scarring actually is, how it's related to the connective tissue, how the different massage techniques help to influence different aspects of wound healing and um, scar tissue development, collagen formation, those kinds of things. So pretty comprehensive. It's not my 2-day science of scar tissue course, which is kind of a deep dive into the science behind it, but we definitely go over it in the whole academy. Yeah.
So the massage is just mainly concentrating in the right in the area of breast, or is just in general the
I would
other.
say abdomen, breast, rib cage, thorax, shoulder, neck. Those are kind of the
Okay.
areas that we focus on because those are
Yeah, so
all areas that are affected by the surgeries. It's beyond just the breast itself, but it's an area of the body that a lot of people just don't really focus on, or they focus on it in a very superficial way. But we teach you
yeah.
how to go into it in a very specific way, very intentional, working with the ligaments, working with the muscular tissue, working with the fascial tissue, working with the lymphatic system, the circulatory system, the nervous system. So there's a variety of different ways that you can approach this whole sort of hip to neck region of the body. Yeah.
All right. And so because I got a little bit confused in terms of like the sort of shorter version on the course and the longer version of the course. Sort of what was like what is the difference between them two?
Yeah, I'm totally happy to go into that. So the shorter version is 3 courses, and it gives you everything you need in those 3 courses to work with this population. It gives you all your foundational material, all the information on the surgeries and the post-op complications, but it's a shorter, more concentrated delivery of the material. So it's 6 8-hour days, and it's this very concentrated download of this of the 3 courses. The longer version is it has all those 3 courses as well, but it's delivered in a bit of a more spread out fashion. Plus, it's got the 4th course, which is the integrative cancer care, which is all related to breast cancer. And one of the biggest differences is that as you are learning the information over the 6-month period, you're also practicing with practice people. You're getting your treatments reviewed so that I can see what you're doing and offer guidance. You're also getting the marketing support so that you're able to reach out into the community around you and share what you're doing, get known in your area, make connections with the different organizations that are serving this population as well. You can make connections with the doctors and the surgeons, local shops, different associations, different societies. So it just gives you a way to really make connections and put yourself out there in the world as this is what I'm doing and this is who I'm working with, so people can find you and you can attract in your clientele, which sounds like it's very applicable for you because one of your goals is to be able to reach out, let people know what you're doing, bring in your clients so that you can get known in your area and you can have a more regular clientele booked for you. So that would be useful for you, right? That marketing part.
Yeah.
Yeah.
Yeah,
And
definitely.
yeah. And then there's
The only
also this
thing,
lovely, oh, sorry, go ahead.
sorry, the only thing what I was worried is about the time difference because it's quite late. I don't know, like in terms of like if I'll have to do you know, doing the clients on that course, I don't know how early or how late would be because usually it's quite difficult where I am right now to get people like on the later time. So I don't
Yeah.
know.
So
That might
yeah,
be
for
my
the,
excuse, but it's just I don't know in the practice, sort of in the real life, how to do it. Probably I'll have to plan it, but I don't
yeah.
know.
So there's two different ways. So if you were doing the 6-day course, then the practice times are very set and specific. So it would be because you're 8 hours ahead of us. So your practice person would be coming to you, generally speaking, about 10 o'clock at night, which might be challenging for some people. But if you're doing the 6-month course, the practice times are on your own time. So you learn the material in our live classes, and then you practice on your own time. You don't practice during the time when the classes are going.
Oh,
So
okay.
then you can schedule them at whatever time is good for you. And then you send in your practice videos to me. So then I can review and give you email feedback. And you get some one-on-one calls with me as well. So if you want to discuss any cases, you've got a person, you're like, whoa, this one's more complex. I want to actually talk to you about it. then you can just schedule one of your one-on-one calls with me and we can discuss it that way. And there's the
Mm.
treatment library that's got all the videos in there for the different techniques. So you can practice alongside the videos if you want. You can have your books open, so you can have all that material available to you while you're doing your practice sessions. But the live
Mm-hmm.
classes with the 6-month academy, they're focused on learning the material. But in the 6-day one, you have to get practice time in those 6 days. So there's 3 practice sessions in those 6 days, and those are set times. They're not flexible. Does that
All
make
right.
sense?
Yeah, so it looks like the 6 months it would be much easier to do.
I think it would be easier, and I think it would give you more of what you're looking for, because you not only
Mm.
want some of the knowledge and the skills, but you also want to be able to reach out into the world around you and make the connections with people so you can build your practice, right? That's an important
Yeah.
component. Yeah. And that's what you get in the 6 months, which is quite different. It's totally different actually than the
Mm.
6-day. Yeah.
Okay. And what is the price for that one?
So for the academy,
Mm-hmm.
the I'm just going to go down to my I've got to
Side.
convert it into British pounds for you.
Ah, okay.
So if you wanted to do monthly payments, there's 6 monthly payments, which would be, this is an average. It will change a little bit day to day with the exchange rate, but basically you're at £465 a month for 6 months. And then
Mm.
there's a commitment deposit of £290.
Sorry,
Or
how
if
much?
you want £290 commitment deposit,
Yeah.
if you want to do the monthly payments. But if you want to do pay in full, and you have the funds available in the next 48 hours, then you can save the commitment deposit plus $300 off your registration, which is about 150 pounds ish. So then your one-time payment would be 2,785 pounds. In Canadian, it's 4,500. But for you, the exchange rate is so much better. You're basically at 2 to 1 for us. So
Okay.
for Canadian people, it's 4,800 for the regular course, but for you, it's 2,780 basically for a one-time fee.
How much is it again? Sorry, it's a one. Is it how much is total? 200,
The one, the
2000.
one time,
Mm.
two, about 2,784 pounds.
Oh, okay. Okay. Yes, the monthly would be probably better for me.
Yeah,
So you're doing in September, so that's September is the starting the 6 months one.
that's correct. Starting on September the 14th.
And do you have any like future dates, like for when you're starting again, or then you're basically gonna run again, sort of something similar?
I don't have the future date set. So
Mm,
this is your opportunity now if it's of interest to you.
okay. Okay, so then I'll have to work out everything. It's just because there's lots of things happening now, and it's just I need to, if it's, yeah, the main thing for me is if I'm able to commit to 6 months. That's the issue I have, because I've been doing like throughout the year I've been doing some courses, and I was really really struggling because I'm still sort of working on my business and I'm by myself, and it's just really hard sometimes, and towards the year lots of other things are happening, so it's just I need to make sure that I have to really think this through properly.
Yeah, I can appreciate that. But on the matter of working on your business by yourself, it's definitely slower and more challenging to do it all by yourself. And part of the focus of the academy is to get your business set up in a way which is logical and step by
Mm.
step Everything is laid out for you. There's so many different templates that we have that will help you with your online booking, with your charting, with your marketing, with your letters of introduction, your reach outs into the community. All those things are prepared for you. There's different templates for your keeping track of your referral partners, of your sessions that you're doing. Like everything is laid out for you so that you don't have to think about all of it yourself. And it absolutely fast tracks the process. Plus, you're transitioning practice people into paying clients while you're in the program. So you actually graduate from the program with paying clients. So not only do you get the structures for setting up your business, but you also actually get the paying clients to be running your business with. So it's definitely going to help you fast track getting your business set up. It's not something that would take away from getting your business set up. It would expedite the process.
Okay.
Yeah.
Yeah, that sounds actually good, everything.
Yeah.
I'll have to have a think about and work it out. Yeah, the expenses and the time what I have on my
Okay.
hands. Because I'm doing
Yeah.
it's not only scar tissue I'm doing, because I'm also doing the skin, and I need to invest also in some machines for skin in order to do some treatments what actually clients were asking me for. So I just need to balance it and see how it works. And I'm actually in the process of doing websites. So I've already paid quite a big lump on some for making my website looking nicer.
Mm-hmm.
So yeah, just need to really think about it. How much time? So when is the exactly course again? In September. There was like
Yep.
12 or
September the
something?
14th,
14th.
Saturday, September the
Okay.
14th. Yep.
14th.
Yeah.
Okay. So I know that so I'll have to let you know as soon as I can, like literally like probably this week or a few days. I have
Yes.
to just
Yeah, for sure.
So
Yeah,
that's why
because
I wanted to just schedule that call as quick as is possible, that I can actually sit down and think properly what I'm doing.
amazing. Yeah, that's so great. Because this way, yeah, because right now I'm doing all the calls from the event that I just did. And we want to make sure for the people who want to join that they've got space to join before we start, because it's not that long. It's just under a month until we start. So you do want to secure your spot for sure if you feel like you're called to it. But it sounds like it's in alignment with what you're looking for. You want light touch techniques that won't burn your hands out. You're doing massage anyway, and it'll just give you some extra skills for that. The knowledge you've already got on scars and skin will be very, very useful. And then no matter what presentation people are coming in with, you'll feel knowledgeable to be able to help them. And it will be in alignment with working on your business so that you can grow it in the direction that you want to grow.
Yeah. Yeah, definitely.
Yeah.
Yeah, I just need to think how to do it. Yeah. And
Yeah.
yeah, I will. Yeah, I need to think, and then we'll let you definitely know
Yeah.
what's
So
happening.
what can I help you with in your thinking process? What would be useful for you?
I don't know if actually it can help me, because I need to sit down and calculate everything and see how everything will work and look in the plan what I have for the next 6 months. Because I really, yeah, because that's the thing. I'm feeling a little bit like financially I'm actually stuck at the moment, because there is so many other expenses, and I just need to see if I can find a different way to get that finances in order and get that commitment, because it's the big issue for me. I'm worried that, because yeah, that I can't commit to longer period of time.
Right.
That's the only issue for me. I mean, that's one of the two issues, the money and basically the commitment. But it's because I just know what happened, and I've took on course, and I'm struggling to finish, and yeah, and I've done like 2 other courses from beginning of the year, and it's just like was too much. So
Right.
that's what it is. Because at the moment, I need to sort of think this properly through. So
So do you
I
think
can't make.
that the 6-day one is better for you?
Which one, the 6-day one?
Yeah. Do you think that's better for you?
Well, I'm not sure because I'm worried about the timing, to be honest.
Right.
That's was my issue, the timing for treatments.
Right.
Because it's really hard, to be honest, find somebody. I'm actually, because the reason why I'm saying, because I even tried to offer some free treatments for scar therapy, and no one literally like contacted me to have a free treatment, which was really
Well,
bizarre. I've
yeah, you
done
would
three
think because it's
times.
free. Yeah.
Yes, I've
Yeah.
done 3 times, and people just like no one. And that's what I'm finding is really difficult as well. I don't know if it's just me, but that's what I know, if it's just me say like the way how I'm saying things. But unless someone has like real problem with pain, they don't really, because the doctors don't say anything here, and they just may mention, not all of them, they may just mention, oh, maybe it would be good to do like massage on the scar, nothing else. And then it's just like they're going home, they left with the pain, and that people literally said, okay, that's what I need to leave now, that's fine because the doctor said that. They don't look for a different alternative. They don't even think there might be something better happening. They're going to physio, and physio is not able to solve the problem because physio is only focusing on the actual problem, on the place where the problem is. But that's not the problem where they have. So they don't look on the global, they don't look on the bigger picture of the things.
Hmm.
So they
Hmm.
may help with the movements, exercises, and things like that, but it's just a little bit tricky. So the people don't have that mind, like, okay, there is different solution for scars after operation, or doing different massage and things like that.
Hmm.
So,
Yeah, I hear you.
and recently I've been also hearing like the area where I am, that lots of people struggling to find a good person for massage, because it's
Hmm.
not that they really want, they need right now as well, but they think that if they do massage because it's relaxing, they will help them, but it's not. So
No. Yeah,
it's
there's more that
really,
needs to be done than just the relaxation for sure.
yeah, so it's completely different, and sometimes it's really difficult to explain to people, like, you don't have to live with pain to the rest of your life.
Hmm.
Like, you don't. There is
Yeah.
solution,
Yeah.
but they just like, oh no, I'm fine. I was like, but you just told me that you're not fine. So
Yeah.
it's like, I don't understand, like, what is the problem?
Yeah. I hear you. So it sounds like maybe there's some languaging which could be refined. It's maybe something in how it's being explained that's causing the hesitancy. But I know in our program, we offer templates for
Mm.
your language to use to reach out for practice bodies. So you don't have to invent all the wording yourself. And everybody who is in our program is able to get practice people. There's not one person who didn't get practice people. Um, some people were a little bit delayed in the beginning. They tried putting it out there and they were like, I wasn't really getting anything. And so then we helped them make some adjustments. And then they were like, oh, now they're coming in and now it's working. So there's language that we give you, there's templates and images that we give you that have been working for people. And then if based on your area, you need a little bit of tweaking here and there, then we can help you with that. So we can take the mystery out of how to get the people in.
All right. But
Yeah.
can you tell me the price of the 6-day one then?
Yes. The 6-day one in British pounds is 1,044 pounds.
And that needs to be paid in one, yeah?
Yeah. No,
Okay.
sorry. No, it can be paid in 3 right now. I don't have it worked out how much it is in
Okay.
3, but I can just call that up in 1 sec.
That would be 480. To be like 482, yeah? So I calculated that it's 482.
Oh, I've got 348.
Oh, okay. So that less.
Yeah. Yeah.
I just literally
58.
divided by 3.
Oh,
That,
right now your exchange rate's about 2 to 1. It's pretty close to 2 to 1.
okay.
Yeah.
All right. Yeah, let me think about it, and I will let you know one way or another. And
Yeah, for sure. Do you want to reconnect
then
again after the weekend?
can I just send you email if anything I'll have a question, then I can actually schedule something, but it's just because I've got this week, I've got mentor for the business, and she just came back from America and literally I need to really focus on work, what I need to give to her for like Friday. And plus I'm doing treatment, so I can't really booked, but I will email you if that's all right.
Yeah, absolutely.
Yeah,
Yep. Yep, for
that's
sure.
the emails what I'm getting from what I was getting from for the sort of the whole 3 days. That's the email to email you directly, or we've got a different one.
Info@mastectomyguide.com.
Okay.
Info at
Okay, so that's what I would
mastectomyguide.com.
do.
Yep. Yep.
Okay, so that would be easier.
Okay, wonderful.
Perfect.
Well, I'll send you an email today with an overview of what we
Yeah,
talked about so that you have that to refer to. And
perfect.
then, yeah, you can have a think about your plan for yourself and your timing. And then if you have any questions, you can reach out and we'll go
Perfect.
from there.
Amazing. Amazing. Thank you so much for your time.
Yeah, you're so welcome. We'll talk to you later.
Take care. Bye.
Bye.